hip and pelvis evaluation, starting with a past and present history, moving on to inspection, checking for swelling, discoloration, and deformities. While your patient is standing, I'll be looking for leg position, looking for anteversion, retroversion, valgum, varum, or hyperextension of the knees. So toe positions being in, out, being knock-kneed. Next would be gait, so I'd have the patient take a few steps towards me and back. All right, you can lie back down. Next will be the Q angle, measuring from the bottom of the knee here up, and the hip angle here. Issues here can lead to patellar tracking problems. Next will be bony palpations, ASIS here, sartorius tendinitis, the larger hip bone here is prominent, the AIIS, checking for rectus femoris tendinitis, which will be lower and it's a little harder to palpate here. Greater trochanter, checking for IT band irritation and bursitis. It's the larger hip bone here, lateral to the leg. The lesser trochanter, a little bit harder to palpate, but it's just below the greater trochanter. Checking for iliopsoas tendinitis, and checking fractures of the femoral neck will be last, which is just diagonal of the greater trochanter. Soft tissue palpations. Starting with the quad, checking for any strains and hematoma. Right, so I'll start with rectus femoris, which is here in the middle, vastus medialis, which is in the medial part of the thigh, vastus lateralis, outer part of the thigh. Next, the adductor muscles, pectineus, kind of in the medial groin area, adductor longus right here, and the adductor magnus in the medial thigh. I'll flip you over under your stomach for me. All right, 3 hamstrings, biceps femoris in the middle, semitendinosus medially, and semimembranosus laterally. All right, special tests. I'll get you to sit up for me. All right. Thomas test here. Let's get a little bit off to the edge. Lie back. Bring your knee to the chest and hug it. Scoot a little more towards me. And I'm checking for the limited extension here. You can scoot up.
Okay.
Positive test would be limited range of motion that's provided there. Okay. You can lie on your side facing that way. Stack your hips. Relax. Top ankle in the armpit, hand on the knee, hand pushing the hip out, or elbow here. So I'll move into flexion, abduction, extension, and then drop here. A little harder to do on the couch. Positive test would be limited range of motion that the IT band would cause here. Next we do leg length measuring. You can lie back. Comparing bilaterally, I don't have a measuring tape on me right now, but a parent would be measuring from the umbilicus to the medial malleolus, and true leg length would be ASIS to medial malleolus, measuring bilaterally. And the last test would be Trierenberg. You can stand up for me. Checking for gluteus medius weakness. So bring your leg up here. And I'm focusing on the opposite hip. Positive test would be any control that's lost on the opposite hip or any instabilities there. Looks good. Okay. Range of motion, get you to lie back down. All right. Flexion here, to 120. Abduction to 45. Adduction to 30. Internal rotation to 45. So legs here at 90, and internal will be knee inward, ankle outward. External is opposite, so bringing the knee out and that ankle in. Perfect. Now I'll flip you over on your tummy. And pulling the leg up here, looking for 30-degree extension. Okay, resisted range of motion. While you have it in your tummy, we'll just do our extension. So put my leg right here, testing the gluteus maximus, hamstrings. So pull up, 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 up. Full leg. One more time. Up. Good. All right, I'll flip you back over on your back. Flexion here, so try to pull that knee to the chest. Testing iliopsoas and rectus femoris. Abductors, so scoot that way a little bit. Push outward. Checking the gluteus medius and gluteus minimus. Adductors going inward. Testing the adductor longus, abbrevius, magnus, and pectineus. Resisted internal rotation, so knee in and trying to kick that leg outward. Go, go, go. Checking the adductors, perfect. And then external rotation, try to go inward. Good. Testing piriformis, obturators, gemellus, and quadris femoris. All right, we can get you to sit up here. Neurological, you can stand up. So just you do as I do. We'll go through these. T12 to L3, hip flexion, knee to the chest. L2 to L4 is knee extension and hip adduction, so pulling inward. Perfect. L4 is dorsiflexion and inversion. L5 is toe extension, so bring the toes towards you, and hip abduction, hip out. Perfect. L5 to S1 is knee flexion, so bending the knee. S1 is ankle eversion, roll the ankle out. Perfect. And S1 to S2 is plantar flexion. And I would compare bilaterally. All right, sensory, you can lay back down here. All right, starting with T12, which is abdomen area just above the genitals. L1, anterior pelvis below T12. L2 here, thigh below inguinal ligament. L1 is just above it, so those kind of surround it. L3 is the medial knee here. L4, medial foot, inner part of the foot. L5 is the dorsum, so just above the toes. S1, lateral foot here. And S2 is medial gastrocnemius, which is the calf. Okay, reflexes, you can sit up. L4, testing the patellar tendon, try to relax the leg here. And trying to chop here, get some sort of flexion there. S1 is the Achilles tendon, cradle the leg, have her try to relax. And I'm trying to chop here and feel a plantar flexion in the foot. Next would be blood flow test, dorsal pedal artery pulse, checking for rate, rhythm, and strength, and finishing with recapillarization of the hands, and the color should return within 2 seconds. Boom.